Thank you for having me. I really appreciate all the work that Rotary Club does around the world and locally too. I haven't devoted my life to educating about plastics. To be clear, I'm working
Oh,
on climate change and health education, but plastics are a big part of climate change and a big part of medical waste, which is my own backyard, really. So I am learning more and more about plastics and the harm it causes to human health and to the environment. And this morning on my news feed, I just got the reminder of the paper that came out, I think, a week ago on how photosynthesis is being affected by microplastics, nanoplastics, and we're in big trouble if that continues. So I wanted to just go ahead and speak today about plastics in human health and what healthcare is trying to do about that. I am at Stanford working on climate change and health education and quite a few other groups around the country. And I wanted to just go over the plastic impact on human exposures. It's affecting our food security, which we just mentioned, the photosynthesis, threatening the ocean, toxic pollutants, as you all know of, the air hazards from plastic being burned. We were told the LA fires, the air was 10 times more toxic from the wildfire smoke than from their normal pollution in LA, which is not good. And lastly, interesting, something that was discovered by one of my colleagues at Stanford, that the plastic waste creates a breeding ground for rodents, and especially mosquitoes, spreading, increasing those vector-borne diseases in developing countries, especially. And we see the potential impacts of plastic on various organs in the human body. This paper that came out just describes that this exposure leads to oxidative stress, inflammation, immune system dysfunction, altered energy metabolism, impaired cell proliferation, disrupted microbial metabolic pathways, abnormal organ development, and carcinogenity. So, causing cancer. Also, they're considered, some of them are called obesogens. They're actually contributing to obesity. And so it's affecting every part of the human physiology. Micro and nanoplastics. So what does that really mean? What about the size, and does it matter? Well, it turns out it does. You can see on this scale here, the microplastics are kind of almost big enough to see in that range, but the nanoplastics are extremely small in nanometers or microns. And we're inhaling a lot of those every day. But what happens, you might hear a lot about something called PM 2.5. That's particulate matter 2.5 microns. And that's the size that can actually lodge into your lower lungs and doesn't come out. So can get stuck there. And usually particles you see floating around are about 10 microns. So you can sneeze them out or you just breathe them back out. But these smaller ones, this PM 2.5, physicians are very concerned about, get into the lower airways and stay there. Now, these particles that are less than 0.1 micron, they actually cross through the alveoli and can cross the capillary barriers. And that's how they're getting into the rest of our organs. So we can inhale the big ones, but we respire. It's called a respiral fraction. And then, so we mentioned, Tammy just wanted me to go over, you hear a lot about these plastics being endocrine disruptors. What does that mean exactly? Well, it disrupts your endocrine system in multiple ways. A lot of times the plastic can just interfere with systems that increase or decrease your normal hormone production, shown on the left, or they mimic the body's natural hormones, which is very commonly estrogen in these plastics, which are associated with breast cancer and decreased fertility in men. And then they can also block the natural key of the hormone. So instead of the hormone being able to stimulate the cell, the disruptor blocks that receptor, and then the natural hormone can't work. So you don't get enough of your hormone. And unfortunately, we can't escape this. I thought, I used to think, well, I'm pretty safe. I don't eat meat and food. I don't use plastic wrap or buy food wrapped in plastic, that type of thing. But there is no escaping it now. I think, as you all know, in this crowd, it's in the soil, in the water, and in the air. And as I showed you before, we are breathing it. And that's how it's getting into all our bodies through all of these systems, and it's growing into our food. So even the vegetables are not safe from this. We also have have it in various places now in our bodies. It's in our brain. We heard about the spoon. Probably you all read that article about enough plastic in our brain to make a plastic spoon. We have it in our lungs. Of course, I mentioned how it can actually lodge there. So it's in our tissue now. In the blood, so depending on the day, about 77% of humans on any given day have these chemicals in their blood. And it can even cause skin inflammation. I was very disturbed to hear my watch band is probably oozing through my skin, delivering plastic into me. Um, and the placenta. So our big worried babies are basically born pre-polluted with plastic. 100% placental samples of maternal fetal blood with particles of polyethylene and polypropylene. And all of these babies born are being shown to have plastic in their first stool sample. And so again, very disturbing there. You may have heard about a few months ago, there was an article that came out about microplastics and cardiovascular health. When microplastics were found in arteries, so after people had died, their arteries were examined, or if they had to take a piece out for surgery, they looked in the arteries that had microplastics in them versus just plaque, caused 4.5 times more death over 3 years in those heart disease patients. So the plastic actually, we think, provides like a scaffolding for the plaque to stick to and increase that plaque and increase the risk of disease and death in these patients. And there's big impact on reproductive health also. I mentioned the fetus getting the plastic, but with this systemic inflammation that can lead to infertility and complications in pregnancy. The endocrine disruption affects fertility, but also the quality of the eggs and the sperm count. This widespread exposure is found in human breast milk, placentas, fetal organs that have been examined of babies who have died at birth. We can measure all this, so we're not just guessing or have one form of measuring. There's several forms of or several ways that we can measure these different chemicals in the blood and in organs. And then what I'm doing is really looking with groups of physicians and our societies. Well, we're part of the problem. Healthcare in the US contributes to about 10% of our greenhouse gases. That's like a whole country and the rest of the world. And of course, is as usual, the US is the biggest polluter in the world. So worldwide, it's about 4.5% of greenhouse gas produced by healthcare, but the US, it's about 10%. And a lot of that comes from plastic. Most of it, in fact, it's not energy use. It's about 75% supply chain, what's called supply chain. So the greenhouse gases are coming from our supplies, most of which now are plastic. And people are noticing. In Maryland, there was a medical waste incinerator was made to pay a fine for exposing the public to biohazardous materials. So many years ago, a group called Practice Green Health got the US to stop incinerating everything from medical waste, but some of it still is, and it's very hazardous smoke. There's also another environmental criminal case in Baltimore, so that from medical waste disposal. And as you can imagine, a lot of this waste is disposed in under-resourced area, people that live in poor neighborhoods who have no say in it. And we know that the US can do better. So I was an ophthalmologist, cataract surgeon, and this is how much on the left, how much garbage we would produce from one cataract operation. On the right is from an eye system in India that's extremely high quality and well respected in the world. And this is the amount of garbage from 93 of the same type of cataract operations in India. Now you might be shocked to find out that they actually have a lower infection rate than the US and the UK. So you think, well, they reuse things, they must have more infection. No, they figured out a way not to. And so this excuse in the US that we have to use plastic once and throw it away to control infection is just not true. It's made up by a lot of regulators, and we are trying to prove them wrong through several research studies. But unfortunately, we have to prove them wrong rather than they had to. decide the right thing. So more than 1.7 million tons per year of plastic waste is generated by the US healthcare system alone, and this is going up every year. So we wanted to find out in ophthalmology, well, is it just a few of us who care, or do my colleagues actually care? Does everybody care? Do physicians care about this, or is it just a select few? We did a survey of cataract surgeons and operating room nurses and found out that 90% are concerned about climate change, most of whom are very concerned. 93% felt that where our trash is too excessive, and again, majority far too much, with another 93, and probably the same folks, saying we should seek ways to reduce our waste. And 78% thought we should seek ways to reuse supplies and instruments. So this was really good news that our colleagues do care. And many just care because it just feels wrong to produce all this garbage yourself all the time. So we decided to get together and start an initiative called I Sustain, which is a global coalition of eye societies, organizations, and ophthalmologists collaborating to make ophthalmologic care and surgery more sustainable. We now have over 50 eye societies worldwide as part of this initiative. It's the biggest, most robust specialty initiative in the world to ophthalmology is leading the way. And the reason we're leading the way is because we're actually the most wasteful specialty. We do so many procedures with 20 million cataract surgeries a year and a lot of retinal injections now that we are actually the most wasteful specialty. So we felt we had a moral obligation to do this and are trying to lead the way for others. And we collaborate with industry. So knowing you're Rotarians, you may be involved with industry. And what we're doing is the industry makes these products for us. Now they're bound by regulations also, but there are a lot of low-hanging fruit, and we're trying to work together to reduce our production of, in this example, paper, getting rid of paper inserts and boxes and putting on QR codes, which we were successful in doing, in reducing the size of our drapes, this craziness of in eye surgery, instead of just putting a lot of people just put a drape over the face and that's enough, which is fine. But half the surgeons in the US still drape the entire body just to operate on an eye. And that those drapes incorporate plastic because very, very few hospitals are still using cloth drapes in the US. So we have industry supporting that they're trying to promote that people go to smaller drapes. They don't make that much money off of draping or certain other things. They don't make much money off of, and they want to actually do the right thing. So industry is working together with us to do these initiatives. But a lot of other healthcare organizations are involved right now in working on reducing plastic and waste in healthcare and educating healthcare providers and the public about the perils of plastic and our medical waste. So these are just several. I'm involved in several of these, but the first few, the Medical Society Consortium on Climate and Health. But this, as Tammy mentioned, Stanford has a Human and Planetary Health Center. And within that, we have a plastics working group. You can contact Allison Phillips if you're interested in joining. It is not restricted to Stanford people or to physicians at all. We'd love to have more people involved and more views and expertise. So a lot of these through My Green Doctor are working on how to practice medicine more sustainably and reduce our waste. We have several societies, a global consortium on climate and health education, and others working to educate physicians, nurses, allied health professionals, and the public on climate and health. And we also have a program at UCSF that's specifically on reproductive health and the environment, looking at many of those plastic studies on reproductive health came out of there. I'm sure there's others, but these are just to let you know that we are working on this. Healthcare does realize it's a huge contributor to plastic waste, and we are working on ways to reduce that and be more sustainable. So what should physicians do themselves? We are recognizing the low cost and convenience of plastics are deceptive. There's more harm to the community, harm to the general public, then we can justify to use those. We want to encourage patients to reduce their plastics and educate them, inventory our own plastics and identify places for reduction, and implement the necessary changes to practice green health to be more sustainable and reduce our environmental impact. We also, through iSustain and especially the Medical Society Consortium on Climate and Health, we advocate for stronger policies. So we're not just working with industry, but we are actually working with legislators, working with our local communities, trying to work with the regulators to advocate for stronger policies that will reduce our institutional plastic dependence. Many healthcare organizations took a Human Health Services HHS pledge a couple years ago to reduce our waste, and Stanford went from kind of doing nothing to now a huge sustainability department in healthcare and winning an award actually nationally for reducing our waste and environmental impact through energy use and other means. So we are involved, and we are just trying to enhance our communication with the public also. And one physician has made a huge difference, Dr. Desiree LeBaude. She's at Stanford and is working with that plastics group I mentioned. She is the one I mentioned before, discovered that in her work as an infectious disease doctor in Kenya, she was there during a drought, and that should be a time where mosquitoes can't really breed much or be prolific, and diseases should be minimized. However, malaria and dengue and all these diseases spread by mosquitoes were actually increased. She said, I don't understand how this could be. And it turned out that these little drops of water remaining in plastic water bottles thrown all over the village and not disposed of properly, if there is a proper way to dispose of these days, were providing breeding grounds for mosquitoes. So actually the number of mosquitoes was increased because of the plastic waste. So she started a group called Erny Kenya, the Health and Environmental Research Institute in Kenya, building education and awareness and community engagement and empowering communities to change any cultural norms around trash collection and safely cleaning up the local environment, strengthening relationship with key stakeholders, government and industry and the community, and working to change policy to decrease plastics, creating recycling programs and jobs, and ultimately decreasing these trash-related health risks. So we have seen that physicians are making a difference. We're trying. We have one physician can make a big difference. We had just a very small group of us start iSustain. Dr. LeBaude herself started Erny Kenya. So we know that we can make a difference and we can get other people on board. So how will you be the change? Thank you.